Hello, everyone. Thank you for joining us today for the next installment of the Recently Diagnosed Online Guide in partnership with the Inova Parkinson's and Movement Disorders Center. I'm John Dean. I'm a speech-language pathologist, and I'm joined here by Josefa Domingos, a physiotherapist, and we are clinicians who specialize in treating Parkinson's and related disorders, and we have done so for the last 20 years or so. So today we're going to talk about key knowledge and strategies to face Parkinson's challenges. And what we've done is we've picked 10 key areas that we think everyone who's recently been diagnosed should be aware of in order to address these challenges when they arrive.
And so starting off on an issue regarding acceptance times. I think it would be common for us to recognize that people will have different times of accepting the diagnosis because we all bring different experiences to the diagnosis. But what is relevant to know is that it's not a matter of, 6 months, 8 months, 10 months, or even a year. What we know is that people have reported that many times the acceptance can even go up to 2 or 3 years. And so I think it is helpful for people to know that process is not something that's supposed to be immediate, and think things like, what's wrong with me that I haven't accepted this and it's been already 3 years. And what's also curious is this acceptance time is not only regarding diagnosis. It's often that I hear when the person is managing their Parkinson and then a new challenge might show up, to which someone might say something like, you must learn to recognize these symptoms are part of the disease, and the person can immediately respond, but I don't want this. So there might be reactions to also moments of change. And I think it should capacitate us to help by understanding that these things might happen so that you can better fight against it. And when we try to think about, where can we get help for these type of situations, people tend to find a lot of comfort in peers, which means other people with Parkinson that have lived with Parkinson for longer. And so the support groups are an example of that. But so you can get messages that bring you comfort on things like Gary is sharing with us. And Gary's from Ireland. He's 56 years old. And he has had Parkinson for 11 years. And he shares with us, I spent too long in denial of my condition and situation. And I really should have looked for help much earlier. So every person might react in different ways. But it's important for people to understand that there is that space for that, and that it does take time, and the help is there.
When you're talking about the help you're getting, I think there's a couple things to be aware of. First, you're going to have to learn how to manage the well-meaning. And those are your friends or your family who say, I just saw this on the news. There's a cure for Parkinson's. Oh, I just saw this. And if you know that you should do this coconut oil in your coffee or whatever. And those people are trying to help you, or they want to give you some hope. But sometimes I think what I hear from folks, at least, is that it gets a little bit overbearing, and more on top of that, it's not necessarily that valuable of information. It's something they saw in a news channel or worse. Mm-hmm. So you have to find a way to politely, okay, thank you, I'll look at this later on. And then another thing I see sometimes is when you are early on in your diagnosis and you go to a support group that maybe covers a whole range of people over a course of the time, it can be a little bit daunting. And so maybe finding a smaller network of people who've been recently diagnosed, this is where online stuff really helps. Although I have seen some nonprofit entities have a group for people who were just diagnosed. That's why we have this group right here, we have this class, because sometimes it's better to get people who are kind of right where you are versus you seeing somebody who's been at it for 20 years. Those people have a lot to offer, and they have a lot of good wisdom. And Gary's a good choice when you talk about that, 11 years. Mm-hmm. But sometimes early on, maybe you want to close that circle a little bit and find people who are really kind of in your own experience in the last 2, 3, 4, 5 years.
And even from my experience, even when you have a very diverse group, it's curious when you're giving an exercise class and you have a break, and there's a tendency for me to see that, the people that are more young onset, for example, will get together. So there's a natural selection of who you're going to identify yourself. It's just because you put into a group and now suddenly I have to be friends with everyone. That's not true. Obviously, we have different profiles and different preferences and stuff. And that will also be something that has to be placed into the equation of who I'm talking to. I do want to highlight that there are people that like to have lots of information right from the get-go, and there's people that will need more time before they start digging into the information. And I think it's just finding out where you are and telling others about that. Is just, I don't want to hear right now all this information about Parkinson. I am being selective in what I choose so that I can also take care of my emotional changes. So I think that's an important way to maybe handle it.
Yeah, there's not a right way or wrong way, so you just got to understand where you are on that spectrum.
So another key, I would say, area is for people to be able to know that in the first years of diagnosis, the type of symptoms that will actually have more impact will be what we call non-motor symptoms, specifically mood changes. And that might not be so clear because we take medication, we feel better, the rigidity, slowness of movement, and so that is controlled, hopefully effectively with the medication. But these other issues might not respond so well. So you might wake up in the morning and you might feel more anxious, and there's no reason to be. Or you might have events happening throughout the day where you get more emotional, where you might cry to things that you didn't used to cry. And so this obviously will have an impact of how you see yourself and how I feel more fragile. But knowing that this is part of how dopamine is affecting your symptoms is probably might bring some comfort to understand what's going on. And how can we identify these different mood changes is based on a key question that even health professionals should be asking you, which is, are you feeling low? And low means it guides us to a specific mood change, which is depression. If you're feeling nervous, that's more related to anxiety, or indifferent, which is more related to apathy while doing basic things in daily life. So these are questions that a person should ask themselves so they can be really vigilant on these changes and how it's impacting you. And so when do we know that these issues are a problem? Because obviously the person just got a diagnosis, it's a major change in life, so it's normal that you would be feeling more depressed with the changes. So we have to have a way to know, is this something that I need to address clinically? And the way that we do that in the clinic is basically asking these 3 key questions, which is, does it persist longer than 1 day at a time? Does it make it difficult for you to carry out your usual activities? And does it make it difficult to be with other people? And you can see this is actually part of a test that the neurologists or clinicians will be assessing you on, just to identify if this is a problem. And you can see that slight means that you have episodes of depressed mood that are not sustained for more than 1 day at a time. We can all have bad days. And that there's no interference with the ability to carry out normal activities and social interactions. So this would be slight interference, right? When you think about, okay, so what would be really severe? Severe would be something like depressed mood that precludes your ability to carry out normal activities and to be with others as well, our social interactions. So keeping in mind, how can we identify that this is an issue that I really have to report to the neurologist? Because there are solutions to it. There are pharmacological solutions and there's other non-pharmacological ways that you can address it. So it's worth reporting it. When we also think about this, we want to highlight something which is sometimes there might be some challenges for people to ask for help. So if you think about it, maybe when we have a broken arm, it's much easier to ask for help. Could you get me a glass of water or something? But when it's these emotional symptoms, people tend to hide them. Could be related to many reasons, but feeling ashamed. Why am I feeling depressed? That there's no reason for me to be sad or anxious, as I previously said. So it's just identifying, knowing that this might happen. Be sure that if you are able to report this is key, because all clinicians and neurologists and specialists will identify this as something that happens commonly in recently diagnosed. And they will provide ways for you to be able to overcome it, either pharmacologically, addressing, adjusting your medication, or also giving you tips on ways that you can really have an impact on it as well. Okay, so thinking about, our third area of information that will potentially be useful for you to use throughout your journey One of the key ones I would say is understanding slow movement, because that is the basis of Parkinson, of your diagnosis as well. So thinking about things like I will take twice as long, how this affects your attention, your concentration, how this affects also your fatigue, and what can I do about it in terms of adherence to medication. Let's reflect on a couple of those. When we think about changes in movement speed, and people tend to always ask me, how am I going to be in 5 years? How am I going to be in 10 years? So I think it's almost unavoidable that people will think about this. And so here is a very honest share of what we know from Parkinson and its progression, is that the slow movement is going to be part of it. And Parkinson is recognized as a disease that progresses slowly, with small interruptions that we'll get to in a minute. But so understanding how does the slow movement impact my daily life? This is just an example. So that means I might take, imagine 30 minutes to get dressed in the morning, and then that I start taking 45 minutes, and then I'm taking a little bit longer. So this is the kind of changes that will slowly be coming in. That also means that it might also have an impact on frustration. If I go into one room and I do something and I take a little longer, then I see something that I forgot to do and then I go do it again, which would be a situation that would happen even outside of the context of Parkinson's disease as we get older, as we get more tired, as we have more interference with the fatigue that we have, mental fatigue as well. But it's just to say that it has a bigger impact in Parkinson's disease. So you'll have things like that where you think that you might have more difficulty understanding what others are saying. And we are in a pretty rushed world, right? So people tend to be doing things faster and faster, which makes living with Parkinson even more challenging. If only we could slow down the universe.
Well, and the amount of digital distractions we have between our phones and what we can get available on television and all these different channels and the computers.
I was thinking more like when you go into a store and they say, so what do you want? You want this, you want this, you want that, you want that, and you are, there's just no time and you have to make a quick decision, and I think that can really block anyone. So we just wanted to share with you, this is what you can expect. Even difficulties maybe getting out of a chair. You might have a difficulty and then you learn some strategies to get over it, and that can be reduced. So this is not like I'm accumulating, but it's continuously that I can't do anything about it. But please do focus on the word slow progression. These are changes that will happen, true, but they are supposed to be controlled specifically very well with the medication. What happens is life. And so there's things specific to Parkinson and there's things specific to life that happen that will generate these situations which are crisis moments. So if we do have like a dental infection, and so that means I'm taking some additional medication that might interfere with my Parkinson medication, or just the infection will interfere with the whole body and system. And so these are situations where you might feel that you get more slower. And I think it's important to understand that, because sometimes people have these situations and they enter into a panic state because it's like, oh my goodness, my Parkinson is worse, I'm getting worse. And then it's just a cascade of negative feelings, and then getting more depressed will make the symptoms even worse. So it's important for us to be able to recognize these crisis moments. And I mean, that's what the health professionals are there for, so they can help you. But I think having these educational programs and also giving you, just a list of things that might make you slower, and that it's not necessarily the progression, it's just situations that are reactive. So you have things like a sudden aggravation of your depression. So if something happens in your family that really makes you depressed, even happiness tends to sometimes have an effect. And then changes in medication, there's always adjustments, changes in environment. So as you can see, there's a list. It's just being understanding that this can happen, and is this an acute change? Is this something that I expect? Is this something that I should be talking with the doctor? Would be the key message here. And the way that we manage. We like to finish this key messages also with giving you at least a quick glimpse of how people manage these issues. So I think the primary message is we try to identify why the person's, imagine if it was a sudden change. Why is there a sudden change to the slowness, and can we address that? So trying to figure out things about what makes it worse and what makes it better. So when I wake up in the morning and I go for a walk, I feel much better, I feel more active. Or if I stay in bed maybe until 10 or 11, then I feel worse the rest of the day. I feel slower throughout the day. So it's just how much, in this case, inactivity is influencing the rest of the day functionality. That could be an example. But just understanding that there's medication that's obviously addressing this. There's also rehab strategies that we teach people so they can do their activities much faster. There's lots of tips and strategies for that section. And then obviously all the rest that you see that everyone will mention about, good diet, sleeping, exercise, and obviously the support groups.
I think that the sleep management is one of these underrated things. We know that most people with Parkinson's have some kind of issue with sleep. So if you can do your part to exercise enough to make sure that you're getting that benefit so that it helps you sleep better, and then you also manage the environment and talk with a doctor if those two aren't helping with it. I think diet, sure, exercise, surely, but sleep is one where I think you can do a lot of good quickly.
Mm-hmm. There's another particular message from slowness, the impact it might have, and that is the impact on social stigma. Unfortunately, being slow is misinterpreted many times in social activities. This was one of the people that I work with in Lisbon that we said, the hardest part is seeing people look at me in that awkward way, wondering if I still know them, as if they're confusing Parkinson with Alzheimer's. So unfortunately, being slow tends to have associated the social stigma, and knowing that might happen might help you interpret better why sometimes some activities in social environments might be more challenging. But we can't change others. We should try if we can, obviously, but it's just having that knowledge should help us better predict those situations and maybe potentially help you not get so much upset. Okay, so we're thinking now, let's go on to an area where we can put a lot of things, which would be things that bring discomfort. And one of the major topics, like John was saying previously, is about sleep. So when there's disruption in these key areas that we're going to talk now, usually this brings on more discomfort in dealing with the disease.
There are three key areas I think you can really address when you're talking about sleep problems. One is the tendency for insomnia, and quite often I hear people, they can fall asleep pretty easily, but then they wake up and they get this what we call sleep fragmentation, where they're waking up 2 or 3 hours later and it's hard for them to fall back asleep. Another one is daytime sleepiness. So throughout the day, if you happen to be seated, or if you're in a position where you're comfortable, or maybe it's after a mealtime and you tend to get a little bit drowsy, that interferes with your day-to-day. And then the last one is called REM sleep behavior disorder, or you'll see it sometimes RBD, that's the way we'll abbreviate it. And that's actually when you act out the dreams that you have, and their dreams are usually pretty active. All three of these can have real impacts on sleep quality, and maybe it's good to just kind of break them down one at a time to see what you can do to address them. The first thing is to look at what are things that you can do that are reversible. So one of them could be a situation where maybe the medications are wearing off. That's a pretty common reason for sleep fragmentation. If you're waking up and you're feeling the soreness that's related to the rigidity, the stiffness, well, okay, that may be a medication thing. Or maybe it's a situation when you're waking up and you're anxious and now you have anxiety. And again, we were talking about the relation to Parkinson's already. So that's something where the doctor could help you with that. Or maybe you can do some mindfulness, or you can do some meditation. Then you can also look at medications that maybe are leading to problems. So throughout the day, maybe you have a medication that's adding to your sleepiness. Maybe you're taking a medication for another part of your Parkinson's or something unrelated to your Parkinson's, and it slows you down and makes you sleepy. And then, fatigue and depression and anxiety are kind of neurochemical those are components of your Parkinson's that are very much related to the dopamine depletion. I remember hearing a great doctor say, if you have a dopamine firing problem, well, you now have a serotonin firing problem and a norepinephrine firing problem. And so you have these underlying issues that a doctor can help you address with medications. And then sleep apnea or other kind of common sleep problems are also things that can be addressed, as well as anything that could be affecting that. Pain is a real common one too.
Mm-hmm. So highlighting, I think, one of the most common situations. So I think it's we can say lots about sleep, obviously, but it's just like, what would be the number one thing that I would share with a person with Parkinson is this situation where try to figure out what symptoms are related to the wearing off. So which means the medication is not having effect. And so if we think about it during the night, we think about, okay, what's happening? Usually the person will have their typical dinner, maybe 5, 7 if you are in the US. And what happens after, and this is more common in my culture, which is after eating, we tend to sit down and watch some TV. Which means people usually tell me they fall asleep on the couch, and then they go to bed, they fall asleep, and then they wake up again. So it's just sometimes when we talk about those behavioral issues, is trying to figure out, so what if I maybe do something active after dinner and don't allow myself to have those sleep attacks in the couch that feels so good, but then might potentially be harmful. And so just suggesting sometimes for people to go out for a walk or to do some sort of activity has helped them manage better the rest of the night. Simple things, as you can see. Now, when we think about the lost dosage, it's like, so the person takes the medication and they go to bed. And what could happen is that after maybe 2/3 of the night, you might wake up and then you can't fall back asleep. I tend to see people using different strategies. So to bypass this, but it kind of like depends on why this is happening. So you might wake up maybe feeling more rigid or discomfort with pain. If you lie more on one shoulder, if maybe you have changes in the temperature of the room or even on yourself. And so these kind of, you can address them in different ways and have different strategies. We do tend to see people referring that if they change places, so maybe if they go to the couch, they might fall asleep there, or if they go and just have maybe a yogurt, or I have been hearing lately some people that wake up and then tend to do some exercise, which is something that we would not naturally recommend because it would, raise your alertness. But it is true that some people have reported that they do slight exercise and actually fall asleep again. So finding that individual strategy at this moment, I think is the greatest message that we can give here. And then figuring out, okay, when I wake up in the morning, when is my first dosage? So sometimes if you are dealing with this type of scenario, this is something that we can communicate with the doctor so that he can find either medication that has a longer effect, or he can reduce the interval between or increase the dosage. So there is ways around this, and it's important for us to tell people that because the sleep is so important. And this is, we're not going to go through the whole slide, but just want you to alert that in the behavioral issues, there are so many different things that people sometimes do naturally and might not think about it, like, have a glass of wine at night or caffeine, that alcohol is probably less obvious because we think it's going to give us sleepiness, but it has been studied to affect the sleep.
I would even put into, for people living in states where marijuana has been legalized, I think that's also a common one, or even CBD, cannabidiol. But again, the quality of sleep you get under those medications, those substances may not be as good, and it's something to talk about with the doctor before you start experimenting too much. Just because you're out doesn't mean you're actually getting sleep, and alcohol is a perfect example too.
Yeah. So there is, as you can see, different tricks that people use and strategies that go all under, behavioral changes that can really impact your sleep, and it's worth diving into that knowledge. Okay, so jumping on to maybe key messages regarding posture and pain. So I think the number one question for pain is always, is this pain related to Parkinson or not? And this is where people feel most lost, and because of that, we usually tend to try to guide them to understand how could you distinguish? So one of the things would be, okay, so is this the type of pain that you used to have? So does it have a temporal relationship with the disease? So did it exist before and or after your diagnosis, and in what time frame? Another one would be, does the pain depend on moments where you feel that your medication should be working? And you might not feel the transitions between the medication, but it's just understanding that, yes, my shoulder pain is mostly in the morning when I wake up. And that can easily be related to the fact that we move less during the night and that you might have less medication, as you saw, so you might have more accumulation of rigidity. And once you start moving it, it becomes better. So, and here we have, so is this, or once you take the medication, this like, does the pain somehow improve with the medication? So you might then take the medications and you feel that the pain is less when you have the effect of the medication. These are very simple ways for us to be able to distinguish, is this related to Parkinson or not? And the relevance of this is either you go to your neurologist and say, listen, I'm dealing with this pain at this time, and I probably need to adjust my dosage on this, or I might need to have some non-pharmacological strategy to deal with this. But if the pain is not, then you think this is not related to Parkinson, you might go a different route, which means you might go do like exams and stuff and understand if there's an underlying musculoskeletal problem. So it's relevant for us to distinguish so that we go to the right professionals and not go jumping around from different professionals. Okay.
It's really common, I think, for people to have some kind of arthritis alongside the Parkinson's.
Yeah, and they do coexist, right? Mm-hmm. It's the same body. So it's the Parkinson is present always. It will affect your muscles. But the way we address it is just it might be more in one direction or another regarding that. So you might have like dystonic pain in the morning where your feet cramp up and you feel that pain and it's impacting your walking, and you would not go to an orthopedic doctor for that. You would go to your neurologist and he would change your medication and that problem will be reduced. See, that's the relevance. Okay, so when we think about, okay, how about posture? Posture is a sensitive topic, especially for families. Because this is a problem that unfortunately creeps up and the person will not notice that they are most of the time, when you imagine you eating and it's your head that's going to the fork and not the fork coming to your mouth, right? Stuff like that. So it's just the way the body is trying to compensate, and because the muscles are being used in an asymmetrical way. So there's always one side more affected than other in Parkinson's disease, and so that means there will be an overuse of the less affected side. And we tend to use more our less affected side, right? And so it's like the brain is erasing the other side. As you can see in this gentleman actually here in the middle, his most affected side is his left, and it's almost like it's not interacting with the rest of the body, right? It's just out there. And so these are things that we want to help people understand from the get-go, not to depress you, but to help you fight against it. So when you are in contact with health professionals that are aware of this, they will be reinforcing exercises and walking patterns and activity patterns that are best to favor your most affected side. So even if you're doing something like boxing, you should be punching more with your most affected side, for example. It is possible to bypass these issues. There might be complications, but it's just understanding that being on top of them is a way for you to deal, and so that they won't happen.
Yeah, awareness is really important.
Yeah. So here's one that brings a lot of discomfort, physical and discomfort.
Yeah. And I don't think that it's well understood. This is a great example where Louise went to 5 different doctors to ask about his constipation, and he got 5 different answers. And we know that that's the case because there can be factors that are related very much to Parkinson's. There can be factors related to diet, but also the constipation itself can actually trigger downstream problems. So if you're not clearing your stomach in a timely fashion, if you're getting some gastroparesis, as we call that, then that means the medications are not going to get absorbed properly in your body, and you're going to have more movement-related problems that really came from the constipation. The constipation kept the medication from being properly absorbed, and then those medications didn't provide the benefit, and now you've got a kind of a compounding problem. I think one thing about constipation is that we also often have a lot of recommendations, and I would just guide you towards another one of our videos in the series talking about that. But I think the first thing you need to do is talk about it with the neurologist first and get a feel for where it's coming from before you start going around to all the different doctors and getting polls from different people who may not know Parkinson's as well as they could.
Mm-hmm. And even I think the neurologist will gather the information from feedback from his own patients that he's been treating about which medication that people actually try that is working best. So even if the scientific community hasn't come to consensus about which is the best medication for constipation, at least you have the experience of someone, of a doctor that deals with people with Parkinson continuously.
Another great reason to just do a shout out that if you're not working with a movement disorder specialist, which is a neurologist that specializes in Parkinson's, it's great to see somebody who works with a lot of people. That's, again, Josefa and I really only work with people living with Parkinson's, and that means we've seen a lot of it. So when someone comes up with something, we may have some advice based on other people's experience. Same thing with your doctor. Mm-hmm. Great point.
Yeah. Okay, so if we continue in our key messages, we think about our next one, which is actually in line with what we are saying, because it is something that is happening more and more, because I think it's very common for a person to have one issue and then he gets referred to a very specific doctor for that issue, and then to another doctor and to another. So what we might see is a lot of challenges for people to understand referrals, and we just wanted to show you that there's actually lots of literature that has been published about the amount of therapists and professionals and clinicians that you can go to for specific problems. And I think you can see clearly in this image that it does induce some sort of panic. I tend to tell people, don't let health professionals turn you into a patient. So especially in recently diagnosed, I think it's important for people to gather knowledge like you're doing here today, so that you know when something is happening. So it's not like, okay, neglect everything. Be attentive, get that knowledge, so that you are able to go, I would say, faster to the right solutions, and not be what I'm calling here ping-ponging from one professional to another professional. Make sure you get that relationship trust with someone that can really guide you in this process as well, because it can become very challenging and scary.
Yeah, I mean, I think getting a long-term relationship with clinicians that know you and know Parkinson's, so that you can rely on them when things crop up, and they also kind of know your profile, your history, what has worked or not worked in the past, what has been a problem that maybe is now turning into something that needs to be addressed more urgently, rather than just like, oh, I think I have this problem, let me get a referral to this specialist or that specialist. I know we have a lot of specialists in the U.S., but
and obviously we have to address the fact that accessibility is not that easy. Especially we would see the neurologist as the key element that would be able to triage all this knowledge and understand when it is relevant or not to go to another doctor. But obviously there's limitations in the time that they have with you as well. And the problem is people might see the neurologist like once a year or 6 months if it's in a good system.
Yeah.
And so I'd say make sure that there's health professionals that are very dedicated to this area. So it could be your physiotherapist that you're working with, maybe twice a week, or even if it's not a health professional, a professional that knows Parkinson, that knows how to identify crisis situations. I would say that's the most precious, because that is someone that, like I gave the example before, you wake up in the morning, you have your feet cramping up, it's dystonia related to OFF. A health professional that knows Parkinson will identify this and will guide you to the neurologist. If imagine it's an exercise professional that doesn't know this, they'll say, why don't we do some stretching, right? So it's just like guiding you, or why don't you go to the orthopedic doctor to see what's going on? And then you come into this cascade of problems. So it's just like, I think the expertise protects you. Okay, so a topic that obviously it's close to my heart, right? Exercise routines. I'm not going to go into a lot of detail, just thinking about if I had, 2 minutes to say something important about exercise, what would I say? And the one that I would highlight would be the social pressure at this moment. in trying to make sense of, everything that everyone tells you that you have to do and you should do, and then corresponding that to what you can actually do. At this moment, we have wonderful, lots of options, but the problem with all those options is like, how do you integrate this into your daily life? How do you make sense of it all? We are recognizing this as a problem, and there are a lot of people trying to help guide the choices at this moment. I wanted to highlight that another typical thing that professionals tend to say a lot is 3 words that they repeat, which is exercise, exercise, exercise. And I found it very intriguing when Michelle said, I can't stand that. And she says, even though I like to exercise and I do it regularly, it really triggers me that people are always telling me to exercise, exercise, exercise. Believe me, she does really like to exercise, but it's just feeling that someone is like telling you what to do that constantly, like you're failing when you don't do it. And how that's contributing to increase her anxiety. And she's recently diagnosed with 2 years of Parkinson.
Yeah, I think
So
it'd be
it's not
debilitating to have
favoring.
someone like, oh,
It's not favoring. It's because she's already motivated. You don't
Yeah.
need to tell that to people that are motivated. We need to, and the people that are not motivated to exercise, you definitely not going to say that.
you're going to find ways to make the exercise more interesting
Exactly.
and fun.
So I think this message is more for the health professionals here.
Yeah.
So we do try to find ways that we can help people make choices about, whatever exercise you're doing at this moment. Try to ask yourself these questions. Is it effective for your health needs or goals? So imagine I want to improve my walking, and what exercise are you doing? Does it help you get closer to that goal of improving your walking? So you might have things that have better evidence for improving walking, like Nordic walking, treadmill, walking on itself. But you say, you know what, I really like it is to bicycle. Indirectly, it might improve your walking, but the truth is the closer and the more similar the exercise is to your goal, probably the better results, the more results you will have. So another key question, is it safe for you? So imagine now you say, okay, you know what, but I can't walk on my own, so I have to cycle. And I say, good, okay, let's keep it safe. We're going to get indirect results, or maybe we can get someone that can help you also add in some walking. So this is where flexibility to try to understand where the person is and its preferences. And when we think enjoying it, so the person can say, I really hate to walk. I hate it. I have no place around my building. I can't do this. There's a lot of traffic, so I don't enjoy it. And so, yes, let's stick with the cycling, because we know that you're going to do that and also get results for what you want. This is just an example. Another important one that people need to ask themselves is, do you believe that you can do it? So sometimes people might say, you know what, you have to do boxing now, vigorous boxing or vigorous cycling, and you honestly think I can't do it. So that is the barrier that's taking you to go there and register. So it's like really having that belief and discussing that with your health professionals so that they can help you understand, yes, you can, your underlying skills that you can do it. And then one that is also very important is accessible. So what is the amount of time that you take to get to your gym? If you are taking 1 hour to get there, 1 hour to do this, and then another hour to get back home, the probability of you sustaining this in time is very reduced. So that means you're creating relationships with people that are very far away and that you probably might lose down the road. So it would be best, at least recommendation, if you build a community close to your home so that it can be more and more accessible, especially having access to it.
Or online too, or
Exactly,
like the classes that we do with the IPMDC.
Yeah, one of the ways for people to bypass that, or on a bad day, technology obviously reduces and makes it more accessible, complementary as well, for sure.
Sure.
So I would say each one of these questions, none of them is more important than the other. They're all important so that you can actually get a good strategy going. And that's all I'll say about exercise. Okay, let's jump into another one, which is mobility. And mobility can be a lot of things as well. But let's put on, so talking about walking, about transfers, which is getting out of the bed, getting into a car, what we do during our day, moving. Communication and obviously cognition. This is where we can, maybe key areas. And all these areas will have their own specific challenges, but we summarize here a way that we usually recommend people to address them. So if you have an issue in one of those areas, the best way for us to effectively manage it is first learn how to recognize a problem early on. So you see how we were talking about posture and how it sneaks up on you. It's just being attentive, having feedback from the family. You know what? You're starting to bend every time we're eating at the table. Let's address this. Let's find a strategy for us to be able to do this. And so how do you know the solution is obviously reporting it. We say doctor here, but it's just like the clinician you're working with, and that would make most sense for you to take care of that issue, right? And then thinking for any problem, it is important for us to understand what are the factors that make it worse, because that helps us understand why it's happening. And then also what makes it better helps us understand the direction of where the solution could be. I think it's two very helpful questions that people have to ask themselves every time something happens. And then knowing that there is multiple options in terms of pharmacological interventions for the diverse symptoms. Some are more limited than others, that's true. And so they are complemented by the non-pharmacological options, and which obviously includes exercise and sleep and diet. But there is all those health professionals that I told you, that we mentioned before, that can also address specific problems.
Just to hit on those adequate pharmacological options, I know that there are people that maybe start off and don't want to take the medications or don't want to increase the medications because it becomes like a metric for progression or advancing problems. And all I'll say is that the research shows pretty clearly that being properly medicated means that you can be better physically active and better participation, and that has benefits right away, quality of life, being able to communicate better, being able to interact with your family better, but also because you're acting more regularly, you're doing your physical exercise more regularly, that actually has long-term benefits. And so I think it's something that you hear a lot, and it's something that try to see what other people with Parkinson's are experiencing, so you can get around that, because it's a long-going problem.
Yeah, for sure. And so you might see things like I'm having difficulties with my driving, I'm having difficulties in organizing my things, sitting. You can see this gentleman took a decision. This is a natural decision that he took to sit in between those two chairs.
He made his own couch.
So we might not recognize the risks so easily. Walking and talking, which will obviously influence, and all these activities will always relate to cognition as well. And now, cognition is one of the topics that most scares people with Parkinson that we talk to, obviously. And so, understanding what are we talking about when we talk about cognition? Let's dive into that.
Yeah, and cognition is so global. It covers so many areas. It's a big part of our communication. It's a big part of our day-to-day awareness, and it's also involved with getting around, with movement and ambulation. So you can see changes in cognition affecting language. And a lot of people talk about, the word finding problem. That's really common, but you can also have issues with just keeping track of a conversation because maybe somebody is distracting you, and then it gets into the attention side of things. Executive function is really kind of your global support system for keeping track of what you're doing, how you're moving, what you're going to do to solve whatever immediate thing you're trying to address. Do I need to get something out of the fridge? Do I need to pick up this utensil or whatever? And then, another area that I don't think people pay enough attention to, but definitely happens in Parkinson's, it's just like the dopamine firing is affecting different parts of your movement. It actually affects your visual spatial system, meaning that you perceive colors differently, you sometimes perceive spaces and how much clearance you have differently, and there's a whole bunch of research on this area. And so this global cognition, if we can address this better, can have influence in a bunch of different areas of your life at once.
Mm-hmm. So I tend to tell the people that I work with, it's just like, I want you to understand that when we talk about cognition, it's key things that are happening. And by knowing this, it should help you understand better, why am I taking longer to do something? Remember the slowness of movement and how it's affected by it. So maybe I'm walking to the fridge, as you can see in this image, and suddenly I get to there and I don't remember what I'm going to go get. This is very typical. It's not even Parkinson. Lots of people will say this. Mm-hmm. But what happens on the way is probably somebody talked with you, or even you distracted with your own thoughts, and then that will have these situations happening more frequently. What I do highlight is lots of things can affect your cognition, and it's important for us, again, to identify what are the factors that make it worse. For example, if the person is having severe sleep issues, if you're having severe depression, it's enough to bring down your cognition. So it's identifying those crisis situations, again, that we talked about. It's fundamental for us to not enter into more panic, which is, oh no, my cognition is changing. Again, just like movement, cognition is something that will be slowly happening also.
Yeah, there can be a real simple trigger that leads to a really big global problem. A lot of times people have extended meal times, and it's actually just because they're getting too many distracting stimuli. People are walking by too much or something. So breaking it down and what causes it, what makes it better, that's right on. How do we address it though, right?
And so the different options, it's like once you can figure out why it's happening, and then you might have different approaches. And obviously these are the specific areas that or interventions that are recognized as having an impact on cognition, which is cognitive training on itself. And you can have physical training showing a lot of benefits of specifically aerobic exercise over global cognitive function. But then there's specific exercises like agility that will have a more impact as well. That's also research that's coming out. And then we've got also a speech training or therapy when we are talking about communication related and cognition issues. And then obviously one topic that we are very passionate about, because it's a solution. I'm passionate about things that are a solution, and that is really integrating physical and cognitive stimulus into the exercises, which means at the end of the day, the person is getting an exercise that touches upon all these difficulties, the physical ones and the cognitive ones as well. And I think it's important for us to reduce the amount of time that people are spending in different professionals. If you go to all four of these versus you go to one and you get the stimulus of all. So it comes back to a solution of making it more feasible. And with the support of the evidence, we will show that it's also efficacious.
Yeah, and also you're addressing things that are kind of like the problems that you're experiencing day to day. It mimics the problems that you would experience. It mimics the skill sets that you need to develop and refine in order to be able to navigate in a normal day-to-day dual task life that we have. Walking down the street and someone's calling you, or you got a phone call while you're talking and walking or unloading the dishes, whatever.
Yeah. So you could have like, okay, I'm having difficulties walking and talking with someone, and so I can train the walking, but if I can train walking and talking at the same time, I'm training specifically again the thing that we need that is challenging you.
Yeah.
And specificity matters. Okay, so diving on to our next topic, and we've kind of touched upon it as well, which has to be the greatest knowledge that I probably can share with someone is for them to understand, someone with Parkinson, that there are good moments and bad moments. And obviously people know this if you're living with Parkinson. And these fluctuations tend to become more organized, which means one of the things that is expected is that the medication is considered effective to treat the slowness of movement and the rigidity, but it will have a time where it's working. And unfortunately, either by progression of the disease, or it's more related to that, or at least the doctors will tell you that, and or the medication not working until the next dosage that you take. So these intervals and these things that you might hear about, these on-off phenomena, most people that are recently diagnosed, I don't have that. It's like, you are not expected to have that, because it's a question of you take your medication and you feel, and we keep it flowing in the system. So that means it's that you take your medication and you stay okay, you don't feel that difference. And then unfortunately, because we have the progression of the disease, you start feeling that there's moments before you take the medication where you might feel different things. And this is an important message. It can be me becoming slower. It can also be me becoming more anxious. So record before you take your medication, and I would say about 20 minutes after as well, because once you take the pill, it takes time to get into the system. And sometimes there might be issues where you had a very large meal and the medication didn't even have effect. So it's understanding Parkinson. I think this would be the most important one, is understanding that it's either the medication is nice and fluid, and then there's situations where, unfortunately, for maybe hydrotherapy, and they are fine, and then suddenly they go into the shower and by mistake they put the cold water, and that is enough to trigger them off. And so this is an unpredictable situation. They wouldn't expect that to happen, or the opposite, So it's a phenomena that's been studied, obviously, regarding medication.
Yeah,
but we don't know exactly what might trigger it. It's very personal specific.
Well, and especially early on, because maybe the medications are bolstering kind of the remaining dopamine that's already in your system. People do get pretty casual and they take the medications at whenever they think they need it, rather than at a regular interval. And I would just say that it's better to train your body early on to get it consistently. Maybe you need to titrate it with your doctor so you get the actual levels right, but getting used to taking it at the same time, every time, on time, as we say, and that is valuable, even if it's not something you notice immediately, because it mitigates this potential down the road.
Yeah, I think this is very important, because there's lots of discussions about this, and people tend to, I feel bad, I'm just going to take a quarter, I'm going to take a half, and it's like the brain might be a little irritated with the fact that he doesn't know when he's going to be fed.
Yeah.
And of course, we want to recognize that it's very challenging for people to, to adhere to medication. This is an area of great research as well. Understanding that if we prescribe one pill, that people will adhere better if it's three times a day, another pill. So these are things that are heavily studied by pharmacological companies.
Mm-hmm.
And we know that Parkinson is probably one of the diseases where the medication is most complex. It's a combination of all of them that makes the effect. And so we want to recognize that. These are things that might lead you. The communication with the doctor. So if you feel, I had a patient recently, she said, I'm scared to go to the doctor. I'm scared he's going to scream at me because I didn't take that medication. And I said, I don't think you're supposed to be scared of him. And I said, don't worry, because they are aware of this. They know that people don't take it, especially, because any human would not take it if they're scared of taking a medication, right? So it's just having a doctor that you can be able to have these communications and not be scared of them. And then, so obviously there's also economical barriers for people to get medication. So that's also another issue.
Yeah.
And then patient-specific behavior, which was what we were mentioning before, how you deal maybe with the less good moments and the anxiety of wanting to take more pills. And I think it's just important to keep that in mind. The brain likes harmony. Right?
You're training your neurotransmitters to expect this at a certain time, and if you break that up, or you get at the wrong time, or you take too much of it, it's too disruptive. That's why your doctor's giving you on a regular schedule.
Yeah. And so we've been also touching upon this one, because it's kind of like implicit in most of which is those crisis situations that kind of like make all the other symptoms go worse. And I just want to highlight that these crisis situations is not only physical, they can also be cognitive. So that means in these crisis situations, you might have things like mental confusion, or remember, it's like you have an infection, or you maybe had a fall or something. And so these reactions in terms of cognition, being more aggressive, or delusions, means that you start thinking about things that you wouldn't usually think about. You might wake up during the night, and the lack of medication makes you have thoughts that you're not supposed to be having. So it's just helping people, or in this scenario, you have some sort of infection, takes you to the hospital, and suddenly you're seeing things that you're not supposed to be seeing. And put this into context. It's important for people to quickly identify these crisis situations, because sometimes they will, the doctor gave me some new medication for my excessive saliva, and suddenly I started seeing people, and I'll wait until the next consultation to tell him this. No, this is where knowledge really protects us, is understanding that what do I do if something is going wrong with something that I take in terms of medication. So yeah, I think that's one of the most important ones.
Yeah, and I mean, you're talking about medication changes, something like an anticholinergic causing that, but also you could have an infection that's growing up, and then that'll crop up, and all of a sudden, somebody who is not normally dealing with real confusion, delirium kind of stuff, all of a sudden starts to address with that. Well, that's not a wait. That's a reach out to the doctor and get advice, and maybe you have to go in for something pretty emergently, pretty quickly.
And as we said, in terms of it's slow progressing in terms of slowness of movement, of motor, but also cognitive. So anything that is sudden change you should always be suspicious of it, because you don't just wake up in the morning and suddenly I'm having all these issues. Right.
A lot of those are pretty easily detected with some blood work too. So it's like if you're getting an infection, okay, you're going to see your changes in your white blood cell count if you get the blood work. So that's why you don't put it off. It's easy to catch. There's not a lot of
that's
things in life that are that easy to catch.
You have like urine infection usually also sneaks in, and the person says, no, but I have no other symptoms. And I say, you know what? Why don't we just go check just for sake of checking, because nothing justifies that there was a change. But I know that the person hardly drinks water, he's dehydrated, he has constipation, and then sure enough, oh yes, it was positive. So you might not even have other symptoms, and it's there.
Yep, that's right on. Good information.
Okay, so we're coming down to the last one. Obviously, we could not exclude life choices, and I tend to say this is something that people hear all the time, which is, what can we include into wellness? And one of the most important things that is being repeated and being studied as well at this moment is the impact of social interaction. So if somebody says, if I have to choose between, well, I hope you don't, between exercise and social interaction, which one would be most important, I would say that probably social interaction brings you cognitive activity, and probably physical as well, because when we're socially interacting, we're walking with friends or something like that. But it's just to say that all of them have their role. I would highlight probably sleep, stress, social. It's hard for me to choose, but I think all of these are very, very important. And I can choose. No, I'm sorry. I know we want to reduce the things that we tell people to do, but this is really a summary of what can I do to stay well. And I'll highlight monitoring, which is getting knowledge, understanding, getting knowledge that doesn't scare you, that is helpful and practical.
And I would even add now, I mean, for those of the people who are a little more tech-minded, there are some interesting emerging technologies that are capturing a lot of the information from your Apple Watch or your Garmin or your Fitbit. And that's interesting because you don't have to actively do the work, or you can actively do the work and track those things. There are actually a couple apps out there made by people living with Parkinson's, and so that adds into your monitoring. But if you don't like that kind of stuff, it doesn't mean, oh, well, I don't have to worry about monitoring. Well, then now you have to just be a little bit more like, okay, this is changing, or I changed this lately, or I've had this problem with my sleep for the last several days, or every time I get done with a meal, maybe I'm getting too sleepy. What do you do about that? It's not rocket science, but you have to be aware of it. You have to pay attention.
Okay, so I think we went through our lists of things that I think might potentially be useful information. And I think in line with one thought, which is understanding the disease reduces fear and helps the acceptance, I think, of process. I have people that tell me I will never accept Parkinson. That's true. But I do have lots of people say that time helps. And that's, I think, is something universal. And so I think just key messages for us to finish here today is recognizing that physical, emotional, and cognitive changes and being able to adapt to them is probably crucial. Being able to modify goals and activities while pursuing things that you'd like to do is also probably also critical. Focusing on what you can control. We get all this information, and it's like, okay, so what am I dealing with today, and what can I do about it? And what can I prevent, but not, I think, not transforming your life into only Parkinson. But once you get the handle of this, then you can forget about it, right? So it's once you feel that you are doing everything that you can against Parkinson, then you can actually forget about Parkinson. So that's kind of my approach to the knowing when to ask for help. I think it's a message that people tend to give others. but without losing independence, which means we control that how much help and fluctuating help as well. Sometimes we need it, sometimes we don't. And then finally, evolving with the disease, finding new ways to cope and to stay engaged physically and cognitively seems to be very helpful, according to what people tell us, and the research as well, of course. And we will finish here with Gary's last message that he gave us, where he says,
give yourself lots of time. Lots and lots of time. And if you find yourself being tearful, don't be surprised. Gary's got a lot of great insights because I think he's been there, but he also came with a really nice social network and good resilience. And I think that's a great way to start.
Because I work with lots of groups, and people tend to be like, no, I'm going to be happy all the time. That's not possible. And, people that are actually sometimes more depressed, they do tend to like other people that are acting normal and also saying, you know what, I also have bad moments. Mm-hmm. So I think it's just important to know that how can I live comfortably with all this uncomfortable things that are happening around me.
Yeah, being realistic, not being Pollyannish about it.
Yeah. So thank you, everyone. We hope that the information was somehow useful. And remember, there's lots of solutions to all the problems that we said. We are in a time where professionals are really focusing on giving you more and more types of responses. And so we hope that you can keep hopeful